put a total of 3 stents in this artery so that you can see the difference between the initial picture and then the afterward picture there. I'm Walt Marquardt. I'm one of the interventional cardiologists at Mercy General Hospital. So these stents have a 95% probability that they will never clog again. College was in Pennsylvania, Western Pennsylvania, and then medical school was at the University of Pittsburgh, Pennsylvania. And that's where I stayed for internship, residency, and 3 years of cardiology fellowship.
How long are you doing this procedure?
I've been doing these since 1988. Well, I finished my interventional training in San Francisco in 1987 with Drs. Myler and Sturzer, who were pioneers in intervention, and then looked for a very high volume position in California, and ended up in Sacramento. That's a good frame there, and then we'll do the work in the LEO. Well, we've had a strong interventional portion of the group since I got here, and we've expanded to a 20-person group, and we have a large geographical coverage area now, ranging from Lodi to Folsom. Let's have the EBU for guide and see if we can get that, what I think is an occluded OM open. Interventionally, we have a lot of research programs going on, as well as just a very high volume of procedures. My personal volume is about 650 cases a year. With more frequent procedures, you become more facile with use of the equipment and understanding of the pathophysiology. So there's a very large advantage, and it's been proven over the years that outcomes are better with higher volume operators. How about a whisper wire and a 2012? But from a research aspect, we have access to the newest technologies. From a volume perspective, we've seen and managed all the potential complications that can arise, and we feel comfortable with any eventuality. If it's an elective procedure, you'd be coming from home to an area called the CSU, where nurses would obtain your laboratory results, and you'd have a discussion about the procedure itself. From that location, you're transported down one floor to the cardiac catheterization laboratory. They'll see a large array of X-ray equipment. There'll be a large, it's called a C-arm. It's a very large metallic object with an image intensifier and a table that seems kind of narrow, but they're made comfortable on that table with a comfortable pad and some arm holders. The room is a little colder than the average room, but we provide the patient with warm blankets and whatever they need to keep them comfortable. The sedation itself usually makes them not really completely aware of the surroundings. They speak, they breathe, they need no assistance. There are no nerves on the inside of the vascular system. So once you get past the numbing of the groin, there's not much sensation. At the end, they usually say, "Have we started yet?"
Thank you.
Well, we've developed a really excellent crew. They all interact great. They've learned how to keep the patient very relaxed and to keep the environment in the cath lab fun, but they're always ready to take care of any emergencies. They're very well trained and responsive. And I think everybody gets along with everybody. 16?
16.
We've really fostered that kind of environment. So it's a comfortable place to work, and we enjoy being in there. It's the high point of the day. Okay, Mr. Slack, we're going to fix your artery, all right? An angiogram typically takes about 20 to 30 minutes. If a stent is going to be done, that adds about an hour to the procedure on the average. The procedure is done with us working at the patient's groin, but looking at a monitor that's at our eye level. At the end of the procedure, either the sheath, which is the short access tube we use to get in the groin, is sewn in for later removal, or it's removed in the catheterization laboratory and the groin puncture site is sealed. After that, the patient's wheeled back to the room and the doctor speaks with the family immediately at that time. So typically the procedure is done that day and the patient's discharged the following day. So you had a moderate-sized heart attack. We fixed the artery causing the heart attack as well as another one that was tightly plugged that was not involved in the heart attack. And everything went smoothly. So this is the before, and there's the after. This job makes me feel like I really did some positive things every day. And I can't think of a day that, didn't leave some recollection of something that was really upbeat or positive for somebody.